Bone consists of a dense, compact layer and a spongy, cancellous structure. While compact bone forms an organized outer shell, cancellous bone consists of thin, interlocking plates called trabeculae. Osteoblasts and osteoclasts are the osteocytes, or bone cells, that make up bone tissue. Bone continually renews its structure and strength through remodeling. Osteoclasts break down existing bone, and osteoblasts build up new bone. In normal bone, adequate physical stress and changing blood calcium levels prompt osteocytes to initiate bone remodeling. Osteoblasts emit a cytokine that transforms immature osteoclasts into mature osteoclasts. In a process called resorption, mature osteoclasts use enzymes to remove existing bone tissue. Then, osteoclasts release chemicals that stimulate immature osteoblasts to mature and release osteoprotegerin, a protein that deactivates osteoclasts, stopping bone resorption. In response, bone formation occurs. Mature osteoblasts deposit osteoid, a matrix that contains minerals such as calcium and phosphorus, and a strong, flexible protein called collagen. Calcium and phosphorus crystallize or mineralize the osteoid, then transform into sturdy hydroxyapatite crystals, completing the bone formation process. In both men and women, before midlife, bone resorption and bone formation are balanced. Hormones and other factors influence bone remodeling. For example, estrogen hormone suppresses osteoclasts, inhibiting resorption to help maintain bone strength. After midlife, estrogen levels fall and osteoclast activity may go unchecked. Increased resorption can lead to bone loss. Osteoporosis is a progressive disease in which the rate of bone resorption exceeds bone formation. As a result, the trabeculae in cancellous bone become fewer and farther apart. The compact bone thins, and overall, the bone becomes weak, fragile, and prone to fractures. Treatments for osteoporosis include calcium and vitamin D supplements to help maintain blood calcium levels, anti-resorptive medications that promote bone strength by preventing osteoclast activation and excessive resorption, anabolic medications which increase osteoblast activity and promote bone formation, and exercise, including weight-bearing activities, which add stress to bone, promoting remodeling.
The cranium is the part of the skull that encloses the brain. It's made up of the frontal bone, which ends at the coronal suture. Behind the frontal bone are the two parietal bones that meet right on midline at the sagittal suture. Right below the parietal bones on each side is a temporal bone. The temporal bone and the parietal bone meet at the squamous suture. Taking a look at the back of the skull, there's one bone that makes up the back of the skull called the occipital bone. And there's the lambdoid suture. Spanning the floor of the cranium is the sphenoid bone. It's kind of shaped like a bat. And spanning the distance between the two orbits is the ethmoid bone. You can see part of it here. The ethmoid bone is a single bone that spans the distance between the orbits. It also projects up into the floor of the skull. That projection is called the crista galli. Around the crista galli is a little recessed area called the cribriform plate. Within the cribriform plate are tiny little openings called the olfactory foramina. Taking a look at the nasal opening, we can see the perpendicular plate coming right down on midline, forms part of the nasal septum. We can also see two of the three nasal concha. We can see the inferior nasal concha, which are bones on their own. We can see the middle nasal concha, which are landmarks of the ethmoid. And the superior nasal concha are never visible from this view. Those are also landmarks of the ethmoid. The sphenoid bone is a bone that spans the floor of the skull. It's shaped like a bat. Here is the body of the bat, and here are the wings of the bat. The body of the bat is called the sella turcica. It's a depression where the pituitary gland sits. These little triangular regions, kind of an overhang type region, are called the lesser wings of the sphenoid bone. And the wings of the bat are known as the greater wings of the sphenoid. These two openings are called the optic canals. On the greater wings of the sphenoid are the foramen rotundum and the foramen ovale. The back of the cranium is made up of one bone called the occipital bone. This is the lambdoid suture. The occipital bone curves around and it forms this area of the skull too. It contains a foramen magnum. And on either side of foramen magnum are these little projections where the skull articulates with the vertebral column called the occipital condyles. This is the temporal bone. There's a hole in the temporal bone, an opening for the ear. That's called the external auditory meatus. Below the external auditory meatus are two projections. One sharp spinous projection, that's the styloid process, and a more blunt projection, the mastoid process. Directly in front of the external auditory meatus is a depression. This depression is the mandibular fossa. Looking at the inferior surface of the skull, we can see the mandibular fossa on the left and the right. Immediately in front of the mandibular fossa is a projection that forms part of the zygomatic arch. It's called the zygomatic process. Some of the smaller facial bones include the nasal bones that make up the bridge of the nose, the zygomatic bones, which are known as the cheekbones, the inferior nasal concha, the maxillary bones, which form the upper jaw. They fuse together on midline, and people refer to this as the maxilla. The maxillary bones form the upper jaw. They fuse together on midline, and people refer to the entire upper jaw as the maxilla. The maxillary bones have the infraorbital foramen. And also, if you take a look at this view, you can see the maxillary bones continue on and form the anterior 2/3 of the roof of the mouth. That's called the palatine process. And right behind the palatine process of the maxilla is the palatine bone. This is the mandible, or the lower jaw. Taking a look at the back of the mandible, you can see this bony knob. That's the part that articulates with the skull. That's called the mandibular condyle. Right in front of the mandibular condyle is a U-shaped notch called the mandibular notch. And anterior to that is the coronoid process. Looking more towards the front of the bone, we can see the mental foramen. The general characteristics of a vertebra include this round, flat disc type portion that's called the body or the centrum. That's the front of the bone. Immediately behind that is a hole called the vertebral foramen. And immediately behind that is the spinous process. So going front to back, body, vertebral foramen, spinous process. In a transverse plane are the transverse processes. There are two regions to this bone that you need to know. In between the spinous process and the transverse processes is a region called the lamina. And then in front of the transverse processes, between transverse process and body, is a region called the pedicle. Taking a look at the side of this bone, you can see how the spinous process is going to project down. So I know this is the top of the bone. And taking a look at the back view, I can see these small flat projections coming off the top. That's the superior articular processes. Taking a look at the front of the bone, I can see again two kind of flat regions. Those are the inferior articular processes. The first two cervical vertebrae are highly specialized. This is C1, the atlas, and this is C2, the axis. Let's start with the atlas. You can see it looks like a bony ring. The large opening in the middle is the vertebral foramen. And you'll notice that there's no body or spinous process on either side. Instead, there's a small portion of the ring that's called the anterior arch. And this larger posterior arch. Coming out in a transverse plane are the transverse processes. And the openings in the transverse processes are the transverse foramen. I can see this is the top of the bone because the superior articular facets are oval shaped and they move towards each other on the anterior arch. Compared to the inferior articular facets, which are more round and flat. The superior articular facets of the atlas articulate with the occipital condyles of the skull. C2, the axis, looks more like a typical vertebra, except for this prominent bony projection called the dens, or the odontoid process. The dens articulates with the anterior arch of the atlas, and the atlas is able to rotate around that bony pivot point. Behind the dens is the vertebral foramen. Behind that is the spinous process. The dens projects up off of the top of the bone. So these two flat surfaces are the superior articular facets. Two unique characteristics of a thoracic vertebra include the demifacets, which you can see towards the back of the body. Here is the body. I can see these two notches. These are the demifacets, where the head of a rib articulates with the body of a thoracic vertebra. The second unique characteristic is on the transverse processes. There's a flattened area called the transverse costal facet, where the tubercle of a rib touches the transverse process. This is an articulated vertebral column. As you can see, the size of the vertebrae increase as you move from the top of the column to the bottom of the column. The lumbar region of the vertebral column consists of 5 vertebrae that make up the lower back. Comparing a lumbar vertebra to vertebrae from other regions of the column, lumbar vertebrae are the largest. Other than their size, the landmarks are the same. Here's the body. The vertebral foramen. The transverse processes. And the spinous process. The spinous process is squared off and is kind of shaped like the head of an axe. The sacrum and the coccyx make up the lower part of the vertebral column. The sacrum is formed by 5 vertebrae fusing together during development. The coccyx is composed of 3 to 5 vertebrae that fuse together. Looking at the back surface of the sacrum, we can see the sacral canal, the sacral foramina, the openings, and the auricular surfaces. These surfaces are where the hip bones articulate with the sacrum to form the sacroiliac joint. This is a typical rib. The curved end of the bone articulates with the vertebral column. There are 3 landmarks at this end of the bone. The head, which articulates with the demifacets of the bodies of the thoracic vertebrae. The neck, and this bony projection, the tubercle, which contacts the transverse costal facets of the transverse processes of the thoracic vertebrae. The more straight end of the bone is the sternal end. This is the part that articulates with the costal cartilage of the rib cage. This is a model of the sternum and the costal cartilage coming off of the sternum. The sternum has three regions. The top kind of shield-shaped region called the manubrium. The body. And then the bony projection at the bottom is called the xiphoid process.
So this is the pelvic girdle that forms our hips. It's made out of 4 bones. So this is an anterior view here. And so the 4 bones, I'm going to tip this up so you can see this superiorly to get a look at all 4 bones. The first bone is the coxa, which we're going to come back to in just a moment. And there's 2 coxa, one on the right, one on the left. We have our sacrum. And then down here you can see our coccyx, not to be confused with the coxa. The coccyx, remember, is part of the vertebral column, and the coxa form our hip bones. There's several areas and parts and articulations that we're going to look at when we look at the pelvic girdle. Anteriorly, the first one is called the pubic symphysis. So here's the pubic symphysis, and it's the most anterior part of our pelvic girdle. Forms that sometimes called the pubic just the pubic symphysis. Cut that out, Mike. Okay, so here's our pubic symphysis forming the anterior part of our pelvic girdle. And it's the joint between the 2 pubic bones. And here you can see the pubis here on the right and a pubis here on the left. So these are our pubis bones. And then I'm going to go ahead and turn our pelvic girdle laterally, so now you're looking at it from the side view, and you can see this very big socket, this big fossa if you like. This is called the acetabulum, and this is going to form our hip joint. So here's our acetabulum forming the hip joint. So my femur is going to articulate here, the head of the femur. Here you can see this passageway here. It's not really a passageway, we call it the obturator foramen. But it's usually covered over with membranes such that very few things pass through this obturator foramen, and in fact it really serves to lighten the weight of the pelvic girdle. And you can see there's one on the other side as well. So here you have your acetabulum and your obturator foramen, and again our pubis bone. And then here, forming the most inferior portion of our pelvic girdle of the coxa bone, is called the ischium. The ischium. So this is the ischium, and this specific part of the ischium that serves as an attachment site for muscles of the back of the leg is called the ischial tuberosity. The ischial tuberosity. And then as we continue to rotate our pelvic girdle to look at the back part of it, so again here you can see our coxa and our sacrum and our coccyx. And so we're looking at the back part, and you can see here that what's known as the ilium. And I'm going to keep rotating it. So here's our ilium, and this forms what's also known as the iliac crest, which is an important attachment site not only for muscles of the back, but also muscles of the buttocks, of the back of the thigh, the iliac crest. You can see here between our ischium, so here's our ischium and our ischial tuberosity, and here's our ilium, and you can see there's this big notch, this big cutout of our bone of the coxa, and this is called the greater sciatic notch or the greater ischiatic notch. And this is where most of the nerves and the blood vessels pass out of the pelvic cavity and down into the leg. So like this is called the greater sciatic notch because the sciatic nerve passes through there. So people who have things like sciatica will often have something going on the sciatic nerve that passes through this, what's known as the greater sciatic notch. And I'm just going to continue to rotate it around. Again, here you can see the acetabulum and the obturator foramen. And then again, from a anterior and slightly superior view here, you can see again the iliac. This is the ilium with the iliac crest. So the iliac crest and then the ilium.
This is the clavicle. The clavicle is a short, dense, S-shaped bone. The sternal end of the clavicle has a flat ending that's perpendicular to the floor. This is where the clavicle articulates with the manubrium of the sternum. The more curved acromial end of the clavicle is where the clavicle articulates with the acromion process of the scapula. The top of the clavicle is pretty smooth compared to the bottom of the clavicle has a lot more texture and this noticeable bump called the conoid tubercle. This is the scapula. One surface of the scapula has projection coming off of it. The other surface is smooth. The smooth surface is the ventral surface. Where you see the spine coming off of it, that's the dorsal surface or the back of the scapula. This is called the spine. At the end of the spine, there's a bony knob that's called the acromion process. Across from the acromion process is another knob that's called the coracoid process. In between the two is a round flat surface that's called the glenoid fossa. That's where the humerus articulates. That forms the shoulder joint. The top of the scapula is this surface that's called the superior border. And in the superior border you can see this little notch that's called the suprascapular notch. This straight flat border is called the medial border. And right underneath the glenoid fossa, that's the lateral border. Knowing that this is the lateral border, right underneath the glenoid fossa, and the spine is on the back, you can see that this bone is a left. This is the humerus. The rounded portion is the top of the humerus, the part that forms the shoulder joint. The ball shape is the head. Next to the head are two bumps. These are the tubercles. The greater tubercle is a little bit higher than the lesser tubercle. In between the tubercles is a groove. This is the intertubercular sulcus. Taking a look down the shaft of the humerus on the same surface as the tubercles, this is the lateral surface, you can see an elevated ridge. This is the deltoid tuberosity. And taking a look at the other end of the bone, the distal end of the bone, the part that forms the elbow joint, you can see it kind of looks like a fist with a thumb sticking out. One surface has a shallow depression, that's the front of the bone. The other surface has a deep depression, that's the back of the bone. So let's start on the front of the bone. At the thumb-like projection, this is the medial epicondyle. Next to the medial epicondyle is a wedge-shaped projection called the trochlea. This rounded region is the capitulum. And this slight elevation is the lateral epicondyle. The shallow depression on the front of the bone is the coronoid fossa. And the deep depression on the back is the olecranon fossa. This is the radius. This is the proximal portion of the radius. You can see the round, flat, disc-like head of the radius. That forms the pivot joint with the ulna, allowing supination and pronation of the hand. Below the head is the neck, and below the neck we can see a little projection called the radial tuberosity. At the bottom of the radius, it's kind of wedge-shaped. This is at the wrist. There's a little projection there called the styloid process. This is the ulna. It has a hook-shaped top that forms the hinge joint of the elbow. The top portion of this hinge, that projection, is called the olecranon process. The C-shaped notch is called the trochlear notch. The bottom projection of the hook is called the coronoid process. Down at the bottom of the ulna is the head of the ulna. That's unusual for the head to be located at the distal end of the bone, and coming off the head is a little projection called the styloid process. This is the hand. There are 8 small marble-shaped bones that make up the wrist. Those are called the carpals. The next 5 bones after the carpals are called the metacarpals. The metacarpals make up the palm of the hand area. And after the metacarpals are all the bones that make up the fingers and the thumb. Those are called the phalanges. Each finger has 3 phalanges, a proximal, a middle, and a distal, except for the thumb, has just a proximal phalanx and a distal phalanx. The first thing that you should do when you're learning this bone is to determine whether you have a right or a left and to orient it the way it is in the body. To do that, you can find this rough surface on the wedge-shaped region. This rough surface faces front, and it's also towards the top of the bone. It's medial, and the socket for the leg is lateral. You can see pubis is coming front and center to form the pubic symphysis. And so you can see that this bone is a right. Once you know if you have a right or a left, make sure that you know the 3 regions. The big wedge-shaped region is called the ilium. And then taking a look at the hole in the bone, you'll see that on one side it's bulkier, that's the ischium. And on the other side of the hole, it's more fragile, that's pubis. Starting with the ilium, starting with that rough articular surface, this is where the sacrum articulates, going across the top of the ilium, this is called the iliac crest, ending at this point called the anterior superior iliac spine. Moving the other direction from that sacral articulation point is the greater sciatic notch, the ischial spine. Right below the ischial spine, where I'm holding the bone, is a thick, bumpy area that's called the ischial tuberosity. The ischial tuberosity is right next to that hole called the obturator foramen. The obturator foramen is very close to, looking at the lateral surface of the bone, the acetabulum, the socket for the femur. Taking a look at pubis on the same surface as the acetabulum, we can see a projection called the pubic tubercle. This is the femur. The top of the femur has the round ball-like head. Let's start there. Taking a look at the ball, that's called the head. And inside of the head is a little depression called the fovea capitis. Right below the head is a depressed area known as the neck. And taking a look at the back of the femur, you can see there are 2 bony projections, the greater trochanter and the lesser trochanter. This is a real bone, so you can see that the spongy bone kind of broke away here. So just taking a look at a model, you can see a little bit better what I'm talking about, the greater trochanter. and the lesser trochanter. Looking down the shaft of the femur, you can see an elevated ridge called the linea aspera. Going down to the bottom of the bone, there are two bony knobs. They're called the condyles. The medial condyle would be on the same surface as the head of the femur, since the head is medial. This is the lateral condyle. And you can see there's a notch between the two. This is the back of the bone. That's called the intercondylar notch. Taking a look at the front of the femur, there's a smooth surface called the patellar surface. This is the tibia. You can see it kind of has a flat wedge-shaped top. This area of the tibia, this is where it articulates with the femur. These are called the condyles. There's the medial condyle. Medial condyle is on the same side of the bone as this projection that comes off the bottom of the bone. That's called the medial malleolus. And then the lateral condyle would be on the opposite side. This projection that you see is called the tibial tuberosity. The fibula is one of the bones that make up the lower leg. It's found between the knee and the ankle, lateral to the tibia. The top of the bone has a more blunt, flat ending. This is the head of the fibula, found near the knee joint. The bottom or distal part of the bone has a more tapered end. This bony extension is called the lateral malleolus. This is the foot. The ankle and the back half of the foot is made of 7 bones called the tarsals. The biggest and most posterior tarsal is called calcaneus. Calcaneus forms the heel. Right in front of calcaneus is a bone called talus. Talus is the bone that articulates with the tibia, so the weight of the body is distributed to the foot on talus. Just past the tarsals are 5 bones called the metatarsals. The toes are formed by the phalanges. Each toe has 3 phalanges, except for the big toe, which has 2 phalanges, the proximal and distal phalanx. Compared to the rest of the toes, have a proximal, middle, and distal phalanx.
A joint is an articulation between bones. Synovial joints, the most common type of joint, show a wide range of form that determines range of movement. Synovial joints, such as the elbow, are relatively simple and permit movement in a single plane. Others, such as the shoulder joint, allow for complex movements in multiple planes. There are 6 types of synovial joints, each distinguished by the shape of the articular surfaces and planes of movement. In descending order of mobility, they are ball and socket joints, such as the glenohumeral joint of the shoulder, condyloid or ellipsoid joints, such as the metacarpophalangeal joints, saddle joints, such as the trapeziometacarpal joint of the thumb, plane or gliding joints, such as the intercarpal joints, hinge joints, such as the humeral ulnar joint of the elbow, and pivot joints, such as the radial ulnar joint of the elbow. A typical synovial joint is characterized by a joint or articular capsule, lined by a synovial membrane, a joint cavity, and articular cartilage covering the contact surfaces of the bones involved. The joint capsule is a connective tissue cuff that encloses the joint cavity. The joint capsule has 2 layers, a thick outer fibrous layer attaches to the articulating bones. Frequently, accessory or collateral ligaments and tendons reinforce the fibrous layer. The delicate inner layer of the joint capsule is the synovial membrane. It produces and absorbs synovial fluid, a viscous substance that lubricates and nourishes the articular surfaces. A layer of hyaline cartilage, known as articular cartilage, covers the surfaces of adjoining bones. The combination of synovial fluid and smooth articular cartilage provides a low-resistance surface for joint movement. Some synovial joints have fibrocartilaginous specializations. An example is the meniscus of the knee joint, which deepens the articular surfaces to increase joint stability and efficiency. It also acts as a shock absorber. Joint specializations such as bursae reduce friction between structures that cross a joint. For example, bursae in the shoulder lie between the joint capsule and several associated tendons.